good, but the dog, we were just playing and it bowled us over. So I think 4 people hurt, but I just don't know.
The dog knocked you all over?
Yeah, knocked us all over.
Okay, are these all at your family reunion, all these
the whole
people?
family here.
Alright, and the dog knocked you over. Can we get the dog removed? Can somebody...
Oh, you can try.
Is one of you the owner? Can you take...
Not me, no. I don't know who owns the dog.
Okay, alright. Just put our stuff down now.
Yeah, I can take it in,
yeah.
alright?
Alright, everybody. Hi, we're the ambulance service. Can I get anybody who can walk come to me right now, please? Anybody who's walking, can you come here, please? Alright. You're the judge? Alright, nice to meet you. Alright. Can you take care of the dog? Can you just keep the dog away from the patients right now? Alright. So guys, can you tell me what's happened here?
My partner over there, she's just, I don't know, she's not right. She's sort of went down and she's not fully conscious.
You think the dog, can you control the dog please? And just keep it away from the patients. Okay, so the dog knocked you all over, you think?
No, we've just been drinking and having a family reunion.
Okay, are any of you injured at all?
No, I'm fine.
We're having a good time. Yeah, alright, can you just stay here? Okay? And we'll just... Okay. So we've currently got 1, 2, 3, 4 patients all lying on the ground. All people who can walk have reported their injuries to me. I'm just going to go and get an update on each of my people on priorities right now. I'm not seeing any more dangers at all. The dog is supposedly managed, so I'm not seeing any other things that I should be worried about. Yeah. Okay. I want backup because we've only got 2 treating paramedics currently, and we've got 4 patients.
Understood.
So I'll get backup as soon as I can, and any other resources we can if they're in the area to assist us.
Keep going.
Okay. So I'm going to just go and get updates on numbers.
What's going on with your chest?
Alright. They're supposedly controlling.
Yeah, and you were playing.
Can you control the dog, please?
Yeah, if you could just come and help me out.
You need to change your gloves, Millie, as well.
Yeah, we've got airways open and clear over here. This is an elderly grandma.
Okay.
But there's blood, and yeah, if you could just take him away from the scene, that'd be brilliant. So we've got an elderly grandma. Airways are open and clear.
Okay.
Blood seems to be on the leg, maybe a fracture.
Okay. All right.
Yeah?
So what are you classifying her as?
She's not able to walk.
So you're classifying her as a 2?
Yeah.
Okay.
Yeah.
A yellow.
Like
Have you done anyone else, or has James done
here
them?
and James has just come back
Okay.
here.
All right. That's fine.
Alright.
Can you go and check that guy out over
no
there
worries.
just for me? All right, James. What have I got?
3 yellows.
3 yellows and an extra yellow over there.
One here, presuming intoxicated, broken leg, and broken forearm, presumably, and chest pain.
Chest pain?
Chest pain, can't move. Dizzy when he stood up.
Okay, alright. Consider maybe further triaging that chest pain.
Yeah, no worries. I'll just do some more.
Are you agreeing with the triaging, which is yellow?
Alright. So currently, we've just done our initial triage sieve, and we've got 4 priority 2s or yellows at the moment.
Okay.
We've got over here airway open. She's got blood on her leg, suspected possible fracture or injury, something like that.
Agreed.
We've got a suspected fracture here of the arm, the lower arm,
Yep.
and also some chest pain. So we're considering possibly triaging that person up once
Agreed.
we establish the source of the pain. We've got a yellow over here who's suspected intoxication.
Agreed.
And we've got a yellow over here suspected fracture of the leg.
Agreed.
At the moment we've got Millie over there treating that, and we've got James over here treating this, but I want to spread my resources out as much as I can at the moment.
Well, what time are we now? 3:30, so in 30 seconds for synopsis.
Okay, alright. Yeah. What's the state on my backup at
They
the
will be here
moment?
in 8 minutes.
8 minutes? Okay. Alright, when they arrive I want to spread them out to people that we haven't yet been able to properly treat at the moment.
Understood.
Okay.
All right.
Really groggy and stuff. Okay,
Alright, James.
can you let me know if it's 50 minutes for me? I'll just be over here.
Are there any resources you need right now?
So this bloke,
First synopsis.
47-year-old male.
Okay, alright. Okay guys, first synopsis. So currently we've had...
They have to be able to hear you.
Okay, first synopsis, we've currently had some sort of incident possibly involving a dog. We've got multiple patients. At the moment we believe we've got 4 patients. At the moment all priority 2 or yellow patients. At the moment they're being managed, but we're waiting on extra resources. We've got a suspected injury over here, possible fracture, suspected fracture here, suspected intoxication here, and another suspected fracture here. All right, I'll give you another synopsis in 4 minutes. Does anybody need any resources right now? Is anybody else in pain or anything that we haven't already addressed? Does anybody need any assistance? No? Okay.
I'm not sure.
Okay, do you need anything, Millie?
No, not at the moment. Everything was, as you said, I'm just about to administer this. James,
Okay, do you want me to check that?
Just given it to me, but yeah, if you can drop
Okay.
it, that'd be brilliant.
So I'm checking the methoxyfluorine for the date. It says 2003, but I'm assuming it's in date for the
Wonderful.
purposes of this scenario.
No worries. Ari, can you tell me if you're allergic to anything?
Hi, what's going on? What's going on?
She's hurt a leg.
You've hurt your leg right here?
Yeah.
What am I seeing? Just
So there's a little bit of blood.
just a little bit. What's your name?
Marianne.
Marianne, okay. Is this leg pain, is that your only pain right now? Yeah? Can you move your leg?
No.
Not at all? Can you wiggle your toes? Is that what
Yes.
you're wiggling? Yeah? It hurts? Is it just your upper thigh here? Am I seeing any deformity or anything? Like, is it an obvious fracture? Yeah? Okay, an obvious femur fracture. All right. If I'm checking, am I getting a pedal pulse? Pulse in her
I
foot?
haven't really been told.
You're getting a pedal pulse, like circulation? All right.
Judge in a yellow
Okay.
vest is beside you.
Yeah. All right. So I've just assessed this patient. Airway breathing is clear at the moment. She's complaining of pain in her upper thigh, obvious deformity indicating probably a femur fracture. She's got a pedal pulse indicating circulation. So at the moment she's a priority 2. But I will get resources to you when I have checks. Yeah, she's going to be all right. She's just probably got a fracture in her leg. All right, I'm just going to go and make sure everyone else is okay, and we'll get resources to you as soon as they're available. Okay. All right, James. Can you give me a quick synopsis on your patient?
47-year-old male, complaining of suspected broken radial ulnar
Yep.
and chest pain radiates to the left shoulder.
Okay.
Doing a quick diagnostic.
Any history of cardiac?
No history.
Okay.
No medications.
All right. Well, keep me updated on what you find there. Okay. She's getting worse. What's happened?
I don't know. She's
Hey, can you hear me? What's going on? My name's Liz. I'm from the ambulance service. What's happened to you?
I don't know.
You don't know? You don't feel right? What? How do you feel sick? Like you're gonna vomit? No. Why? What? How do you feel? Just unwell? Okay. Do you have any medical history at all?
Why am I here?
I don't know. Do you have any medical history?
I'm not sure.
You're not sure? Do you know if she has any medical history at all?
Not really.
Not really.
This hasn't happened before either. So
She's been intoxicated today?
yeah, we've all had drinks and stuff.
Yeah, alright. Do you think you can help me put her in recovery position? Do you know how to do that? That's just if she vomits, so then it doesn't occlude her airway. Yes?
We can call the town or someone to get this dog.
Okay, yeah, I'll get that done.
8 minutes. Check.
Okay.
Synopsis.
Alright. Okay, team, synopsis. Millie, James, everybody, synopsis. So currently, we're at the same stage. We've got 4 patients. Some sort of incident has happened. Currently, they're all classified as priority 2. So we've got over here a suspected femur fracture, but circulation is still stable. We've got over here a suspected lower arm fracture, but we've also got chest pain, so we might upgrade that to a priority 1. We've got over here a possible intoxication, but I'm trying to get a history out of that. She's not feeling very well, but still currently priority 2. We've got over here another priority 2 with a suspected leg fracture that's been medicated for pain relief at the moment.
With a history of epilepsy.
Pediatric history of epilepsy. Okay, we'll think about upgrading that if we want to. Okay, does anybody need any more
No,
assistance?
but I'm now free.
Okay, can you go and just check this lady out?
No worries.
Check.
Okay. All right, James, have you Had anything else?
Full lead, just 120 sinus attack.
Okay.
Still complaining of chest pain that radiates to the shoulder. So
Is there any evidence of infarction?
no evidence of infarction on the full lead.
Okay.
So I think you maybe just to manage it, maybe give him aspirin and GTN if you need anything else, but otherwise.
All right. Yeah, I think stay with this patient. But if you're happy currently to keep it at a priority 2, or do you want to upgrade because of the chest
I
pain?
don't know what's causing his chest pain.
Okay. All right. Do you want any pain relief?
Yeah, if you can, just maybe we'll get aspirin going.
Aspirin? Yeah. I'll grab the drugs.
47. Might get a blood pressure and might give him GTN.
Okay. Have you got a blood pressure cuff
Yeah, I'll
in there?
do
All right. I think
Sorry about
it's in the
this,
drug bag, isn't it?
Tash, come on. Looking back at this. Oh man.
You got aspirin and GTN.
Anybody in the family got any medical training or anything?
I'll ask. What do you need that for, James?
I don't need that for.
What do you need
Just
medical
thinking
training for?
You can use someone to manage resources.
Okay. I'll be there in a second.
She doesn't usually drink, did you say?
No, she, like we drink normally.
All right, Millie,
See what happens after.
are you happy with her?
Yes.
Because we need resources over there. We've got a suspected mid-shaft femur fracture.
Yeah, okay.
So she'll need pain relief and possible traction.
Yeah, all right.
If you're happy with her state,
Yeah, no, she's unconscious, drifting in and out.
unconscious
Yeah,
now.
well, yeah, she's talking to me, then stops talking to me and commence again.
Okay.
So I'd prefer to stay here as a
All right.
bystander that we could use for training.
Yeah, okay, I'll do that. Yeah,
that'd be brilliant.
Okay.
Thank you.
I have a bystander.
Anything, Liz? Anything you want to tell me?
I'm just looking for a bystander currently to go and take manual traction on our patient over there.
Okay. We can probably supply one bystander.
Yeah. Okay, can I just have your assistance over here? Okay. Okay, so what's your name again?
Marianne.
Marianne. Okay, so Marianne has a suspected fracture in her leg.
Yep.
Okay, so what we're going to do is we're going to roll her onto her back, and I'm just going to get you to hold her leg nice and straight, okay?
Yep.
Yeah, so if you can just hold it really nice and still, because that's her injured leg. Okay, can you assist me with rolling her over?
Your mutt rolled me over.
Can you assist me?
Well, now I'm helping, so.
Okay, alright, just hold that for now. Okay, so guys, final synopsis, James, Millie, anyone else who wants to listen? So we've got an incident here, we've got 4 patients, all currently still priority 2. We've got over here a mid-shaft femur fracture that at the moment we're taking manual traction on. We've got a suspected lower arm fracture with chest pain. We've got over here intoxication, but she's got an altered level of consciousness, so she might be upgraded to a P1 in the future. And we've got a pediatric fracture over here with a history of epilepsy. So we're just managing that. Resources are about 4 minutes away now. So once they arrive, we'll distribute that and transport. Does anybody require any more assistance? James, do you require any more assistance?
Perfect. But now this next.
Okay, all right. Okay, so what we're going to do is we're just going to roll her onto her back. So if you just hold her leg nice, just pull this one through. All right, so if you want to help me, so I'll just hold her head and you're just going to slowly roll her just onto her back. All right, Marianne? I'm just going to roll you. It might hurt a little bit. All right. Okay, do you have any pain anywhere else, Marianne? No? Nowhere? Okay, so you just hold that nice and straight, okay?
Yep.
And just keep holding it like that. Yes? Confirm STEMI? Alright, so upgrade to priority 1? Okay, alright, I'll radio dispatch and he can be on the first transport out.
Man in the yellow vest is beside you.
Okay, where's my man in the yellow vest?
So, it does 12 lead. I'm going to use chest up to 12 lead.
Yeah, she had dinner last night.
Yeah, and everything was normal?
Are you alright, Millie?
Yeah, she's all unknown. She's only had about 3 drinks, which is normal for her. She
Okay.
hasn't had any drugs, but her GCS is 13.
So possibly some sort of medical condition
Yeah,
underlying.
yeah.
Alright.
So we're just about
Okay.
to go through all that. And
Alright, do you have any
trauma.
any assistance you require? No.
good.
Okay.
Thank you.
Alright.
Have we got oxygen on anyone?
I think we might be getting it on the STEMI patient, but I can ask
When
James.
backup arrives, if
Yes.
I can grab
Yep, that's fine. Yep, no problem. How are you going?
Dizzy.
You feel dizzy?
Yeah,
Is that because the drugs are making you feel dizzy?
I think so.
You think so? It doesn't feel like you might be having a seizure?
No.
No? Okay. Alright, well, is the pain better now?
Yeah.
Yeah? Okay. Alright, well, you just call out if you need any help, okay?
Okay.
Okay, so currently we've got 3 priority 2s.
Stop! Time!
Just about
Back up.
to...
Cut off.
Yeah. What I was going to say...
Fill up every moment.
Yeah.
Every moment. Overflowing.
Yeah.
We're going back to N10.
Yeah.
Sorry if the camera skills weren't up to
You're doing a good job.